come to collect you for your surgery, is that okay?
Right.
In the UK, some 3 million major operations are carried out every year.
Nice big deep breath. We'll look after you, don't worry.
Only the country's top surgeons are skilled enough to take on the most critical cases.
Cameron, you all right?
Just take a couple of deep breaths.
If you're going to make a hole in someone, you better be sure what you're going to do.
Should we go for it? Right.
They're using pioneering techniques to treat conditions that used to kill.
A few years ago, these operations were felt to be too big or too dangerous.
But pushing the boundaries of modern medicine comes with great risk.
Just keep quiet for a second, please. If we move the blade too much, she's going to wake up unable to breathe.
Life is precious. It can vanish in a heartbeat.
Whoa!
You need to keep your head. Hold this. The heart is empty. We haven't got any volume at the top. If you panic, the patient can bleed to death.
The surgeons bear the ultimate responsibility.
I need it ASAP. I can't wait for this.
I'm not infallible. Failure is absolutely possible.
We are a team, but there's one person's name at the top of the bed.
Bloody hell.
This is what really happens behind the closed doors of their operating theatres.
This is a battle, us versus the Grim Reaper. And we're not going to lose.
I walk to and from work, and it's great because it gives you time to think. You're so in the zone when you're operating that, the day just goes.
Tim Martin is a consultant maxillofacial surgeon at the Queen Elizabeth Hospital, Birmingham.
I was never a high performer at school. On reflection, I can't quite believe that I'm in a position where I'm doing the type of surgery I do now.
He specialises in tackling complex cases affecting the face and jaw.
As a surgical team, we're lucky that we get these challenges. But the difficulty with some of these big cases is that we don't have certainty. Sometimes there just isn't that information out there.
Today, Tim's preparing to operate on a patient with a condition he's never treated before.
And there is bone loss, but it's definitely progressive.
9 months ago, a woman whose face was rapidly being consumed from the inside was referred to Tim.
If you look at the most recent CT, she's got this big soft tissue mass here and a defect in the maxilla and a little bit of breach at the back.
Her upper jawbone and eye socket were being eaten away by a disease, and the surrounding muscle and tissue was becoming inflamed and tough.
It just destroyed things. My initial assumption was, oh my word, this is going to be a cancer. But when the biopsy came back as inflammation, I very quickly realised that we've got a disease that we don't really understand.
Tim asked the team to investigate further to try to establish what was wrong.
The pathologist was saying to me, well, leave it with me, I'll do some more tests. And that's when he comes back and says, well, actually, this is looking like tumour-factor fibroinflammatory disease, which is really unusual.
It's a disease that causes the body's immune system to attack bone and flesh. And it's so rare that only a handful of surgeons in the world have ever attempted to operate on patients with this condition.
There's no real information about the natural history of this, the mortality of this. I'm nervous, and I think we're all a bit nervous, aren't we?
Tim's patient is 49-year-old former police officer, Loretta.
The first thing you're aware of when you wake up in the morning is that your mouth has been fused. It's like somebody's sewn your mouth shut. It just feels like this monster.
Not long ago, she had a busy, active life. Now she's in agonising pain and almost housebound.
Certainly didn't see it coming. Never saw this one coming. Particularly with something so rare.
It's difficult to watch your wife suffer so much, but you have no option. You can only be there and try and support them.
Loretta has undergone months of chemotherapy and steroids in an attempt to combat the disease, without success. The condition is continuing to destroy the tissue and bone in her jaw.
Just common sense suggested that actually we've got to get rid of all of this. But you kind of feel almost backed into a corner, in that I really don't want to operate on Loretta, but we know that, you know, there aren't many options left. Loretta?
The problem for Tim is that there is no medical protocol for how to proceed.
How's your mouth opening now? That's
worse than ever. Yeah,
so your mouth
almost now that it's almost like it's wired shut now.
Yeah.
That is me trying to force it open.
Yeah.
So it's liquid diet only, and it has been now for about 6 weeks.
Okay.
Yeah, and it's worrying. It's worrying now. It's really getting to the stage where we kind of feel like we've thrown everything in the kitchen sink pretty much.
I agree.
At it.
We're in a position with you now where surgery's what we're hanging a hat on. But in your case, we haven't got any experience, but no one has. Coming to conclusions for treatment with Loretta is really rather uncomfortable. I'm going to remove that left upper jaw, and then it goes back a couple of inches deep to my finger here.
Okay, where there's a recess.
Yeah, it is difficult because it's out of the back of the jaw, and there are big veins there, and it is getting into an area which is, in inverted commas, that horrible phrase that surgeons use, kind of tiger country, but it is. My take on tiger country, it's an area where you've got to be particularly careful, where there are vital bits of anatomy that could be damaged, and complications can rapidly spiral out of control. Clearly you're nervous about this, and I think I've let you know we're nervous about this as well.
What's comforting is that we've always seemed to have been on the same page and almost come to the same decisions at around the same time.
Yeah.
There's nobody I'd rather be under the care of. It takes a special person to do what these people do.
I'm shitting bricks. I really am shitting bricks. No, I'm nervous about this one. Yeah.
Where are we going?
64-year-old Nora is also facing surgery to treat an extremely rare disease. She's come to the QE with her daughter, Helen.
Nora. Yeah, hello there, my name's Ellen.
Hello.
You'll be going into surgery in 24, I'll take you there.
Nora has an unusual cancerous tumour called a clival chordoma, located at the junction of the brain and spine. It was only discovered by chance after a recent family outing.
Don't bang your head.
I went with my son and 2 grandchildren, and I went for a ride on one of the fairground rides. It was one of those rides that lifts you up in the air and then drops you down very quickly and stops just before it hits the ground. And when it stopped, I felt a really bad pain in my neck.
A scan revealed that some of the bones in Nora's neck had been fractured because they had been weakened by a tumour near the base of her skull. The bulk of Nora's tumour lies in front of her brainstem. This is an area at the top of the spinal cord which controls the flow of messages between the rest of the brain and the body. The growth is surrounded by important blood vessels and the nerves that allow Nora to swallow and breathe.
If I don't have anything done, the tumour will just keep on growing, so I've got to do something. You just don't know what's going on inside you, do you?
Nora has already had an operation to stabilise the bones in her neck. Now, She is pinning her hopes on neurosurgeon Alex Baluzzi. But the position of the tumour makes removing it one of the most challenging procedures Alex has ever attempted.
I think there's always a time in a surgeon's career when they come across something they've never seen before, and you never know what's going to happen.
There's a risk that operating so close to the brainstem could cause Nora to suffer a stroke or leave her disabled. So Alex has brought in ear, nose and throat specialist Shaz Ahmed to help plan the surgery.
So you get the two main vessels that bring blood to the hemispheres of the brain. It's like the two snakes guarding the treasure, and you've got the tumour there in between.
This is certainly the most complex skull-based pathology that I have been involved in my career.
I would tend to agree with that. You make a lot of calculations and you do think about different scenarios. Are we going to make the patient worse? How many operations are we going to do?
Between them, Alex and Shaz have amassed hundreds of operating hours on skull-based tumours. And at the Queen Elizabeth, they have perfected a technique which involves operating through the nose.
When the two of us come through the nose, then we'll be operating through a very narrow, confined space.
It's impossible to tell from the scan if the tumour will be soft and easy to remove, or fibrous and tough.
We might find that it's so fibrous that it's very difficult to pull out without causing damage to important structures. Things can go sort of pear-shaped very quickly.
I'm scared and I'm worried, but I know they're the best doctors are doing it and it's the best chance for her.
In these circumstances, if we didn't do the operation within a matter of probably a few months, it is likely that Nora would die. Just a few details just before we take you down to theatre. I know you signed a consent form a few weeks ago.
It's hard to see your mum worried, but she's brave.
The biggest fear is that something goes wrong and I end up not able to care for myself.
Okay, thank you.
My dad had a stroke and I saw what it did to him. It just wrecked him, really. If it goes wrong, well, the chance you have to take. I haven't really got any choice.
It's just the uncertainty of how she's going to be when she comes back, I think. There's so many things that can go wrong.
The team assembling for Nora's procedure anticipate having to operate for at least 7 hours in Theatre 21.
Okay, the trick when you're going off to sleep is just to think of something nice, somewhere else you'd rather be. Nice holiday, somewhere hot.
Everyone ready? Set and slide. That's great. Okay.
To access the tumour deep inside Nora's head without making incisions in her face, Alex and Shaz will navigate through her nostrils. First, they need to clear a pathway via her nose and sinus to reach the brainstem, where the tumour is growing.
Once you're all set up, to have the room lights off, please.
Yep. That's lovely.
They're using a specially designed endoscopic camera. Shaz makes the initial approach using a tiny endoscopic scalpel.
May I have suction, please? A procedure like Nora's, we try not to become daunted by it. It's why we're here. This is why I became a skull-based surgeon.
In order to reach the tumour, Shaz needs to tunnel through a bony structure called a turbinate within the nasal passage. Alex then removes the fragments of bone and enlarges the path Shaz has made.
challenge is working in a small space. In a way, it's a little bit like dancing together. You don't want to step on each other's toes. Jackie, guys, I need a little bit of concentration.
Okay, can the irrigation go up, please?
Millimetre by millimetre, Shaz is drilling through the bone that's blocking his route to the tumour.
We're going many centimetres deeper than the usual place where the back of the nose is. 30. We know from the scan that the tumour comes right up.
After almost an hour of tunnelling, Shaz gets glimpses of the tumour on his monitor.
We're right onto it already. This is tumour, yeah? That's why it's, there's no bone here.
Shaz has reached the cancer next to Nora's brainstem. Only now will the surgeons find out whether or not its texture will make it easy to remove.
So I think there's parts of it which are quite soft.
Yeah.
Have a feel, see what you think.
Is it suckable at all?
Up close, the tumour is far more fibrous.
Very vascular, very tough. The nature of the beast is completely different. When you try and gently tease it out, you don't know what it is going to be stuck to. Either it's a tumour that wants to come out or it isn't. And this isn't. We're not going to achieve much here.
After almost an hour of painstaking efforts, Alex is struggling to make progress.
There are times during difficult operations where you reach the brick wall. I'm thinking whether we should actually just stop and...
Do you want me to work on the lower bit for a little while?
Yeah, why don't you?
Shaz offers to tackle the tumour from a different angle.
I have the through biter next.
But as the tumour is packed with blood vessels, it's hard to distinguish from the surrounding tissue. Cutting it out is delicate work.
What we don't want to be doing is pulling the tumour and pulling nerves and brain structures underneath.
But Shaz's new line of attack is helping him make inroads into the tumour.
This is soft tissue, so I think this could be it here.
When somebody thinks that we cannot do anything further because of the way you've been approaching things, then you got somebody who thinks in a slightly different way. That's the beauty of working together in these situations. Nice one, Charles.
Could have a Mexican wave then.
When tackling a tumour, does luck come into it? Well, that's what makes surgery really challenging.
After 45 minutes, Shaz has successfully removed the bulk of the tumour. He and Alex have now reached the lining of the brain, called the dura.
The dura is very diseased.
The dura is a protective membrane which surrounds the brain and spinal cord. It seems that Nora's condition has also spread into this vital layer.
Removing the dura in an area in the skull base is always a big step. It's not taken lightly. There is a risk of stroke, of very serious disability. The ultimate risk is the risk of death.
It's up to Alex to decide what course of action to take.
So I think I would just take the dura out.
Okay.
Yep. You okay with that?
Yep, let's go for it.
Very few surgeons operate on the dura so close to the brainstem.
So we're looking at the front part of the brainstem. It's not a view you see every day. It's like looking at somebody's soul.
Alex has cut out a patch of diseased dura the size of a postage stamp.
One of the most difficult things in any operation is to know exactly when to stop. There's nobody there telling you. You're ultimately the judge of that. I would just stop there.
Close?
Yeah.
If the team try to take more tumour, they run the risk of leaving Nora disabled.
It's about having a patient achieve the goals that they want to achieve, as well as the goals that you want to achieve, and trying to somehow meet in the middle.
I think we got about 70–80% of the tumour out, which was a great result.
It went well for you, it went well for Shaz, it went well for the patient.
Well, let's wait until she wakes up.
She'll be all right. She will.
It's taken them nearly 10 hours to remove as much cancerous tissue as possible and to repair the dura.
Unfortunately, we left a small portion of the tumour, and that was difficult to reach through the nose. I've done as much as I can safely do, and no matter how disappointing it is, you have to stop.
Could well take a while for her to come round.
I have removed about 80% of the tumour, but how is that 20% going to behave? How am I going to tackle that 20%?
Home for the next 2 weeks.
It's the morning of former police officer Loretta's operation. She's returning to the Queen Elizabeth with her mother, sister and husband.
I've never been in hospital for an operation before, so it's the fear of the unknown.
It's the first time on record any surgeon in the UK has attempted to operate on the rare condition she's suffering from. A huge undertaking for consultant Tim. So his friend and colleague Sat Palmer will be helping him.
I'd probably communicate with Sat arguably more than Sarah, my wife. And we're forever taking the mickey out of each other.
Tim and I have been working together for 15 years. He's one of my best friends. My cut's going to be like that.
Yeah.
And then you're only able to have the courage to take on a lot of the big cases if you've got close colleagues that you totally trust.
Loretta, my name's Fleur. We're going to check you in. We're going to go into both warders and get a trolley ready for you.
As all other treatments have failed to stop the spread of the rare condition destroying her face, surgery is Loretta's last resort.
I'm terrified that potentially it could be the last time. Say goodbye to my family.
Gonna be all right. To bring your wife to hospital, and there is always that small chance. You don't know whether it's you're going to see him again.
Did the royal wave.
There's so much I want to do still. I'm too young to die. You really do feel helpless, and your life literally is in your surgeon's hands, and they become your hero and your god.
Loretta's operation is expected to last at least 10 hours in Theatre 8.
I hope you had a better night's sleep last night than I did.
I did actually. I slept quite well actually. I woke up at about 4, which is, and then worried a little bit and then went back to sleep. With Loretta, I've had 6 months to get to know her. And, she is a friend, and I do talk to her on my mobile. She's got my mobile, I speak to her. So that just adds on the pressure a bit more.
That's all right. You have a good sleep for us now, Loretta. Okay, we'll take care of you now, okay? All right, all done.
On 3, 1, 2, 3.
As so little is known about Loretta's condition, It's been difficult for Tim to be sure the risks of such major surgery are worth taking.
You're right there, Tim.
Ish.
Okay.
Part of you thinks, are we doing the right thing? The problem for Loretta is that we're all in the dark. We don't know what the future's going to hold. Dry swab marker pen.
Tim will focus on removing the diseased jawbone and muscle from Loretta's skull, while Sat will take bone from her hip to create a bespoke graft that will become Loretta's new jaw. The graft will include bone, muscle, and 2 blood vessels. It needs to fit perfectly into the diseased area cut out by Tim. Then the graft's blood vessels will have to be connected to the artery and vein in Loretta's neck before the team can reconstruct her face. First, Tim's cutting through the diseased muscle on the left of Loretta's face to access the bone.
There's the jug, but it's not separating from the jug as nicely as you'd hope for, is it? Definitely abnormal. All the muscles attached to the bone have all become scarred and thickened and inflamed. So she cannot physically open her mouth, and it just makes surgery really difficult. Open wide, squeeze, 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 squeeze. Push, let go. Bloody hell. And this is where it's all disease, isn't it? Yeah, this is definitely abnormal there. Yeah, I'm comfortable that we're doing the right thing.
While Tim focuses on cutting out the inflamed tissue, Sat has started to expose Loretta's hip bone, ready to make the graft for her face.
Can I have a screw, please? A 12mm screw?
For accuracy, he's using a 3D cutting guide, which precisely replicates the diseased section they're removing from Loretta's upper jaw. It's only possible thanks to pioneering 3D computer modelling methods.
Sometimes we have really unique cases come in, and it's quite difficult because you've never designed for something like that, which is quite challenging.
Heather Goodrum is the first 3D biomedical technician in the UK's National Health Service.
So this is Loretta. This is the pelvic bone. So we've created a cutting guide which they can place onto the bone, and it will sit perfectly because it's been created on the patient's CT scan. They can cut round that using it like a stencil.
After she's mapped out each guide on the computer, Heather's designs emerge from the 3D printer in resin.
So this is the guide that sits on the pelvis, and once that's cut, it will come up to her face.
Finally, any remaining residue is filed away, leaving only the bespoke model.
It just literally clicks into place. Very accurate.
By reducing time-consuming guesswork in theatre, 3D guides save around £20,000 per operation.
Science, art and technology are all combined into one.
Now 3.5 hours into the operation, Sat relies on the cutting guide to extract exactly the right amount of bone from Loretta's hip.
So I need to take a little bit more of this edge. So it generally looks really good.
Once the graft is prepared, Sat leaves it connected to the blood supply until they're ready for it to be moved to Loretta's face. But cutting out the diseased area of muscle and bone is proving difficult.
God, it's all just so tight. God, no wonder she couldn't open her mouth. These muscles that should have been nice and soft and pliable seem just like really kind of tanned, hard leather. Still, God, blimey. That is just fixed, isn't it? Prior to getting in here, I was rather hoping that we could open the jaw to get in there, because we need to get deep down. And that's just not the case. Her jaw's just not budging.
So am I, mate, but fucking hell, it's hard.
If the muscle and soft tissues aren't going to budge, then we're going to have to break the jaw.
To reach the area of bone and muscle he needs to remove, Tim's only option is to slice right through Loretta's jawbone.
Can I have a saw, please?
Breaking the jaw or dividing the jaw at the back here is something that we do not infrequently. We know that there's a sizable artery that can cause trouble, but you can normally control it.
But with the abnormal tissue hardened around it, Loretta's artery has been distorted.
Not what we want. Oh, bollocks.
The saw has cut the artery. I've got to control this, but I know that this isn't going to be easy.
Toughen up, please.
Oh, sorry.
If she loses more than a litre of blood, he may have to abort the operation.
If that bleed gets out of control, we're going to be a bit stuffed. All hands on deck. May I have another Langenbeck, please?
When things start going wrong, everything just kind of zooms in onto the problem. And for me, I lose all sense of what's happening around me.
All right, Tim. It's all a bit fraught at the moment. I'm going to need some hands in a minute.
There's no point freezing. You've got to do something.
Tim can't prise Loretta's jaw apart in order to reach in and clamp the artery.
That is just horrible.
To stem the bleeding, he sticks his finger in the hole.
Suckers blocked, everyone. We need, Deb, can we get two suckers, please, quickly?
The moment he asks to keep changing the suckers is often an indication to me that he's stressed.
The artery is so hardened by disease, Tim is struggling to clamp it and stop the bleed.
I'm just thinking now about not doing any more harm than we already have.
Mentally, we all have a picture of how you want the whole surgery to go. And if it doesn't go as well as you want it to, there are always seeds of doubt that appear as to whether you've made the right decision to operate.
You can see the hole there. Sam, don't move, whatever. Thank you. That looks like your artery underneath.
By taking a route through the top of the jaw, they eventually succeed in clamping the artery, stopping the bleeding.
Thank you very much, everyone. That's lovely. Perfect.
If Sat hadn't been there, it would have been a lot harder. It's about the psychological support in these bigger cases where you're pushing the boundaries of your own surgical ability.
Are you guys all right?
I wasn't. I don't normally get stressed, but this one's really made me stressed.
What was going through my mind was, should we be thinking of bailing out? By proceeding, are we going to make things worse? I know that we've got to go deeper still. You know, if this occurs deeper down, we're going to be in a bit of a pickle. But in actual fact, we've gone past the point of no return. Well, we've just got to crack on.
This isn't an indicator of what's to come.
Following surgery to remove an unusual tumour through her nose, Nora's been closely monitored. Although 80% of her cancer was cut out from around her brainstem, her latest scan shows her remaining tumour is growing aggressively.
When I saw the MRI scan, I was quite shocked because that small lump that we couldn't reach from the nose had grown dramatically. It was initially the size of a small hazelnut, and it became the size of a mandarin.
I'll have one on each.
Of the kids.
Thank you. It's just going to keep growing and then it might do more damage. It's a bit scary, really.
Because the tumour is so close to Nora's brainstem, she's at high risk of suffering a fatal stroke.
So this is a very active tumour. So we have a limited window of opportunity now.
Just feels bad for Mum, really. It's just every time she seems to get back on her feet, it's like it starts again. But hopefully this one will get the rest of what's left and can start to look forward a bit more.
I think I'm coming towards the end of it now. You're quite frightened because you don't know what's going to happen and you don't know if you're going to survive.
This might feel a bit cold and achy going up the arm. A couple of nice deep breaths. We'll see you when it's all done.
The remnants of tumour that couldn't be reached via Nora's nose are rapidly regrowing at the back of her brainstem. This time, Alex will need to cut a window in her skull behind the ear before pulling back her brain to access the tumour. He'll have to navigate the nerves for breathing, swallowing and speaking, which all lie in his path.
It is one of the most challenging operations you do in neurosurgery, where you're pushing the limits of your capabilities. You don't know whether you're going to be able to remove that tumour. Even the slightest movement can cause a permanent damage.
To avoid damaging any of these nerves, Alex has enlisted the help of consultant ear, nose and throat specialist, Richard Irving. An expert in a technique called nerve monitoring, he inserts recording needles into her tongue, allowing him to monitor 12 vital nerves that relay information from the brain.
This one here, and that's number 11.
Each recording needle will trigger an alarm if Alex comes too close.
We all okay to start? Yeah. So this is the previous incision, so we're going to reopen here. It's good to approach a second stage or a third stage procedure with a white canvas. You don't want the bias from the previous procedure to interfere with your decision making too much. So we should get down to the tumour quite, hopefully quite nicely. A bad experience shouldn't prevent you from trying again. Otherwise, we would never do anything. But at the same time, you obviously want to be cautious. Okay, knife, please. I have the RPMs up to 75,000, please.
Alex drills through Nora's skull to create the window to access the underside of her brain.
And now I've taken out quite a generous sort of bone window. So the next step is to open the dura. It will allow us to sort of retract the brain. Hopefully without causing any damage.
He carefully draws back the brain to reveal the tumour beneath, nestled around the brainstem.
Well, I like to use the analogy with food. The tumour grew to the size of a meatball, and essentially the cranial nerves are like spaghetti in front of the meatball. The name of the game today is trying to eat the meatball without breaking the spaghetti and without spilling any sauce. Can we have the stimulator and the volume up now?
Volume up, please, on the stimulator.
Now Alex has gained access, he will be relying on the beep of the monitor to help him navigate the nerves.
Facial.
Anything now?
Yeah, that's vagus and glossopharyngeal. Nothing.
It's taken 90 minutes to isolate the nerves. Now Alex is ready to attack the tumour.
Being careful not to damage those nerves. When we face a case like Nora's, and we know that there's a huge degree of uncertainty about the beast we're dealing with, put yourself together and you go through a checklist of things that you can do. Just going to cut through the tumour, right in between the nerves. If I move the blade too much, I'm going to sever one of those nerves, which means she's going to wake up with it, unable to swallow or to breathe. Now working blindly behind the lower cranial nerves. Oh, it's a nasty tumour. Horrible tumour.
Using a sucker, Alex must remove the tumour, one tiny piece at a time.
There's a limit to how comfortable you can be trying to minimize any movement at the tip of your fingers. After a few hours, you realize that your shoulders tend to tense up. It's important to maintain that focus throughout the operation. Even the slightest movement or lapse in your concentration can spell disaster. Okay, so we were very close to facial nerve now. We haven't actually seen it yet. I need to be very careful. Whoa! What nerve is that?
Number
What
6.
tells the nerve keeps firing?
The alarm means that Alex is hitting Nora's facial nerve. There is a risk he is causing damage.
Unfortunately, the only way to get down there is to stretch those fibers, which is not ideal, but there's no way around, really. We know that the cranial nerves are plastered on top of the tumour. It's very, very challenging when you're dealing with a fibrous tumour, something that is very difficult to pull out. The facial nerve was stuck to the tumour. There is a certain pressure you have to put onto those nerves. It's very difficult.
Alex manages to remove more of the tumour without snapping the nerve which controls Nora's facial expressions.
So I'm just dissecting the tumour from the brainstem now.
At last, he's deep enough to work on the area of tumour, right alongside her brainstem.
Seems to have come away quite nicely then.
I wouldn't say nicely. So I think we call it a day. Can we keep the microscope sterile?
Yep.
After almost 7 hours of operating, Alex hasn't been able to remove the entire tumour, but he has taken 95%.
I reached a situation where am I going to stop here or can I make things even better? Now it's very difficult to draw that line.
Going well, Alex?
Yes and no.
Okay.
Although the operation has gone largely to plan, the team are concerned it may have caused permanent damage to Nora's cranial nerves.
See how she wakes up now. We need to know what she's like straight away.
It's good to see respiratory effort, but really we want to see some swallowing and some coughing at this point. And there's not much of that going on.
One of the most anxious moments of being a neurosurgeon is towards the end of an operation. And you got that 20 minutes when you ask yourself, is this patient going to wake up? And if they're going to wake up, Are they going to be okay?
Bit of a swallow. Definitely swallowing.
Okay, well, that's quite reassuring.
Yeah, but no real cough.
Okay. I hope it's a temporary thing.
Open your eyes, Nora. That's it, well done. Listen, I'd like you to give me a little gentle cough.
Yeah, excellent. The best moment of the day is actually when you finish an operation and your patient wakes up. Excellent. And all of a sudden, sort of your muscles become like jelly and you realise how tense you've been. Nora, it's Mr. Paluzzi here. So everything went okay? You managed to remove most of it, okay? Okay.
While many of the routine operations at the QE have been completed, Tim and Sat are only halfway through Loretta's procedure in Theatre 8.
So that's lovely. Okay, I've got the saw.
After 5 hours of surgery, they've reached the point when the hip bone graft is about to be plumbed into Loretta's face. To keep the bone and muscle alive, its artery and vein will be attached to another artery and vein in Loretta's neck. But first, Tim must extract the diseased section of Loretta's jawbone.
Pterygoid chisel.
And a mallet.
Every minute. Cheers, mate.
Tim's sawn through the bone and is about to prise it out.
Nearly there. Okay.
The diseased bone is removed in one piece.
I just have a feel around, Sat. Tell me what you think. Clearance-wise, I don't think I could do much more.
No, agreed.
I think the most stressful bit is actually once the abnormal tissue has been removed and you see the hole. And then you suddenly think, we've got to put this back together.
The added complication is that once the hip bone graft is removed from the body, it has less than an hour to live.
You only detach the muscle and bone once you're absolutely ready, because during that time, it's got no blood supply. So there is a pressure to get it done as quickly as possible.
It's time for Tim to position the graft into the hole in Loretta's face.
Can you just gently hold that? Scissors, please. Jameson's. Let's see if we can get this thing to fit. If we just let everything go, yeah, that's beautiful. That's bang on.
You've done one of the goals that you've set out to achieve. So there is an element of relief.
Woohoo! Okay, can we reel the microscope in, thanks?
Now Tim and Sat must face the painstaking task of plumbing in the graft's blood supply.
What do you want to do? Artery or vein?
You've been very kind to me today,
Right.
so whichever you want.
I'm going to do the artery.
Okay. Can I zoom in?
Rejoining the ends of arteries just 4 millimeters wide is a test of technique.
You truly are stitching with stitches that are thinner than a hair.
It's a bit temperamental, this artery.
Tim manages to stitch the two ends together. Next, he needs to see whether blood can flow through.
The problem we've got with Loretta is the blood vessels in the neck are involved with this disease. And so the real worry here is, are these vessels going to flow?
I've got the clamp off there and it's just not flowing. Why the fuck isn't that flowing? We might have to look at the artery again.
Okay. Tim, why don't we take it fully down again and then trim it back?
The artery in Loretta's neck has been damaged by the disease, causing Tim's connection to fail. They need to unpick all the stitches and trim the vessel back. Only then can they attempt to stitch it to the graft's artery again.
You can just get that shit out of it. Can you pull it up at all or not? Or are you pulling?
I will do. Once I'll let this go and then I'll pull it up.
Once it's finally connected, the blood should start to flow down the artery into the bone graft.
Thank you, that's perfect. You probably let go, Saf. I think it may be strong enough.
With the vessel reconnected, it's time to test the flow again.
You're waiting for this blood to flow through your joint. So there's a lot at stake. And you begin to think, well, my word, if this doesn't work, we've really got to start coming up with a solution.
Sluggish.
It's going to be tentative, little bugger, though.
That's starting.
Fucking, it took a little while, though, didn't it? Did you see? Fucking hell.
Have you found flow?
Yeah.
Well done.
They look for signs of bleeding as confirmation that the graft has a function in blood supply.
Yeah. Lovely. So the bone's bleeding up there.
And the muscle is bleeding at the back end.
Sorry for being so fucking nervous.
I think whenever you've done a big procedure like this, there's this big adrenaline rush. I mean, I still get excited by surgery. I think it'd be a very sad day when surgery doesn't excite me.
We've done as much as we can with the disease. Clearance-wise, there's no way we could have done better than that. I'll tell you something, I've not worried so much.
It's been a struggle.
In 14 years.
Time almost stands still during a long operation.
In the end, Loretta's operation has taken Tim and Sat 12 hours.
Cheers, mate. Thank you. Yeah, I was worried about this. I know now, in retrospect, why I was nervous about it. It was, you know, as operations go, quite nerve-wracking. But we've done it because the natural history of this disease seems to be progressive, and if we missed the boat and it started going into the base of the skull, then it potentially could be life-limiting.
Neurosurgeon Alex Paluzzi is visiting Nora to discuss her post-operative care.
Knock.
Come here, Mr. Plum.
Hi, Nora.
It's been 2 months since Nora's last operation, when 95% of her tumour was removed.
It's good to see that you've come through those big operations
Right, yeah.
in good conditions. I think I reached the maximum of what I can do surgically.
Yeah.
And now I'm going to hand you over to my colleagues, and they will begin the next stage of your treatment,
Okay.
which is the radiotherapy. So the hope is that the radiotherapy will keep it under control.
Yeah.
Okay. How long for, I do not know.
Yes, I understand that.
So this is the end of a chapter, if you want.
Yeah. Okay then, Mr. Paluzzi.
Okay.
No more hand-holding with me.
Never too much.
So Italian.
Yes, I get that a lot.
Yeah. Okay, thank you. See you later.
Bye, Helen.
Thank you for everything.
Pleasure. I was hoping that the outcome would be better, that we were able to remove the whole of the tumour. Unfortunately, you need to accept the fact that you're dealing with a disease which is too hard to fight. What I know is that if we didn't intervene, then the disease would have taken its course much faster.
It's 2 weeks since Loretta's operation. Today she's back at the Queen Elizabeth Birmingham for a checkup on her progress with surgeon Tim Martin.
I'm a little bit nervous about seeing Loretta because she's had time to think about this, and I just wanted to say that it was worthwhile doing it. My biggest worry is that she'll come in and say, I wish I hadn't had it done. Hello. How are things, first of all?
Pretty darn good, I have to say.
Okay.
Physically,
Yes.
I think since we got over that first week where...
It was tough.
Yeah, it was tough.
So the hollow's setting in, isn't it?
It is now the swelling's going down.
Yeah.
It's all nicely recessed.
Let me get my gloves on. So inside your mouth looks great. Those little stitches up there we're going to leave. Okay. Just bite together on your back teeth. Okay, so you might struggle just to get the right bite, but that looks okay. I think looking at you, there's a few things that need doing. I think getting teeth will make a big difference. So we'll hopefully be able to fill the hollow up here.
Yeah.
This bit of swelling at the back there, I think, will go down a bit more, but you probably need a bit of filling out here. And what might be nice is to put some fat in here as well. So my take on this disease, having treated Loretta, it's nasty. The tissues are hard to deal with. It's still a disease process not to underestimate.
For the moment, Loretta is out of danger. Surgery has stopped the disease from progressing into the base of her skull.
I think I'm comfortable we've done the right thing. Hopefully you are as well.
It could have been a whole lot worse, and that would have been, I honestly think if we had chosen not to go ahead with the surgery.
I think things will be different.
Yeah, I think they'd be a lot different then.
I think it's...
You have just been amazing, honestly.
Lovely, cheers. And just call if I can do anything.
Oh, thank you.
Cheers, bye now.
There are lots of moments where I've honestly thought this cannot have a happy ending. The nice thing is today, I think we're coming out fairly confident that we've got a future. And we couldn't be more excited. We're thrilled. What amazing people out there.
It makes me feel good that she's as positive and as bubbly as she is. So medicine's all about pushing boundaries. For Loretta, undoubtedly, it was the right thing to do, for so many reasons.